All right, Dr. Buford, we're just getting started on the right shoulder. We're looking in from the back to the front. Everything's magnified a lot, as much as 40 times. And right now we can see a blue cannula coming in the front. Your biceps tendon is this structure running up between 6 and 12 o'clock on the screen. Remember, you're laying on your side, so the top of the screen is really heading up towards the top of your shoulder, and that's where the rotator cuff tear is. Here you can see the rotator cuff tear. I'm going to put in a shaver. We can go ahead and open up our cuff anchors and stuff. We're going to put in a shaver here, and this allows us to clean up the part that's torn and have a real good idea of how much of a repair we're going to have to do. This is pretty much what we expected to find. And the good news is it looks like your biceps tendon is okay. Okay, so now we're looking around the back of the shoulder. This is inside the joint. This is the posterior capsule, which looks great. Happy with that. Posterior glenoid. There isn't much loss of cartilage, so that's encouraging. And it's another way of saying not much arthritis. You can look around the front of the shoulder. There's a little bit of fraying. I'll take that. A little bit of fraying on the labrum, but this is really just almost microscopic in nature right here. Not much to worry about. And then when we look down the front, here's the anterior band of the inferior glenohumeral ligament. There's the middle glenohumeral ligament right there. Okay, so I think inside the joint we've seen everything we need to see. We've done the first step in the repair, which is in the space from the undersurface. Now we're going to switch positions with your shoulder. Okay, so here's the tear. This is your biceps tendon right here, right there. And then this is where the tear is, just posterior to it. And so we've unroofed it. We can see that the tendon really inserts back at the articular margin right about there, so I don't think I need to go any farther posterior. That looks pretty good. I just need to make sure I get the full thickness of this. We're going to place our suture anchor down right where that crochet hook is touching the bone, right there. And just tack this down for you. Just wanted to show you where we're starting. Just to give you the overall picture, this is the subacromial space. And there's the tear right there. Spinal needle. Okay, so here we use a spinal needle just to check our angle of insertion. That's the articular margin. If I kept going down that way, that would go down into the joint. We're going to cheat back maybe 4 or 5 millimeters and place an anchor right about there. Okay, so here's the triple loaded anchor. This is an all suture anchor, which is why we like it. I'm going to reach in and take out this blue and white striped one first. You can see how that sits there. These other sutures we just leave out of the way, and now we're going to place a grasper in the front, so we'll give that to our helper in the front. And we'll take the straight crescent suture hook in the back. So here's the suture hook. It's loaded with a black wire called a super shuttle. You can see that. And now you're on the camera, 2 hands. One on the light cord. And we're going to use this little grasper to help us. We're going to make sure we get the full thickness of this tendon here, like that. I'm going to start back here. And there you can see I get all the way underneath. I'm going to feed that black wire. The reason we use that relay is because we can't pass the suture by itself, and that relay has a bunch of holes in it that we can use to capture the suture. And then it does just like it's named. It relays the suture back. We'll show you one time here so you'll have an idea of how that looks. So there, as we go slowly, you see how it captures that suture there, and then we just keep pulling. Next we'll use a turn to the right. And so, a grasper please. So now the blue and white suture is coming out the back here. We'll just get the rest of it and keep pulling. And then we'll take a crochet hook, get the partner suture, And now we've got those two out of the way, so that's great. So the next step, we're going to keep using that cannula on the left to pass the suture, which means I'm going to take the next suture out the front again. Here we go here. Now this one's a solid blue. You can see why they're three different colors. So next, we'll take the turn to the right suture hook. Okay, pull back a little bit. Yep, great. On the camera here. And now see how this one has a little bit of a different curve. It's loaded with the same black wire. And we rehearse the stitch by placing the tip right where we'd like it to come out. That would be a great shot. So if I just backtrack, that means I want to go in right about here. But before I do that, I want to use my grasper to make sure I'm doing that while the tendon's reduced, because I want this to hold the tendon like that. So now we'll do it again. So if I want the tendon to sit like that without too much tension, that means we need to go in right about here. Push in a little bit. Straight. Yeah. Okay, that's good. There we go. You just push through. You have a good strong tendon, so we'll grab the relay here. Pause. Okay, so now we're going to place our final stitch. This hook goes the opposite way. It's what we call a turn to the left. And just like we did on the last one, we're going to grab the tendon a little bit, see what it looks like reduced, and then backtrack so we know we want our stitch right about here. Let me do it one more time. Yeah. Okay, pause. Okay, so we're pretty much done. Let me show you what we've done here. We've tied all three sutures. This is the most anterior suture. This is the middle one. And remember that blue and white striped one was the first one, and it's right there. And already it looks a lot better to me. We've got this anchored down to the bone. And we've got one more little trick in our bag here. See how we've got this open space here? We're going to make some little holes in the bone. I'm sure we're down to the bone. Yeah, so we're going to make some little holes in the bone right here. Grab a mallet. Okay, and so with this size tear, we'll make a hole right here. Go ahead. Keep going. Keep going. I'll tell you one. See that shoulder? Keep going. Yep, right there. So there's one hole. And then we'll make another one over here. Go for it. Great. Okay, and so that's our final trick. And so when I turn down the pressure on the pump, or even turn it off, you'll see some of the bone marrow elements start to come out of those little holes. You can see it already there. Okay, and that helps in the healing because that has a bunch of growth factors and proteins and things that help things heal. So we're going to finish up here. I really hope this does the trick for you, okay? Good luck to you now. Bye-bye.